What separates confident pediatric providers from the overwhelmed providers is knowing what to look for in exams. Today, we're going to talk about well-child exams in infancy, which is going to be at 1 month, 2, 4, 6, 9, and 12 months. Now, I do want to back just a little bit and talk about the first exam. If the baby is discharged from the hospital before the 48-hour mark, then within that 48-hour time frame, they need to be seen in a primary care clinic. So let's talk about feeding. During the first 6 months of life, we want the baby to be taking in breast milk. Ideally, we want this to continue until the baby is at least 12 months. The baby is going to use maternal iron stores for the first 6 months of life, and then after that, then iron fortified cereal can be used. The benefits of breast milk are there: decreased illness, decreased allergies, and decreased incidences of the baby being obese. The calories that a baby should take in the first 6 months of life is going to be 120 kilocalories per kg per day. And then from 6 to 12 months, it's going to be 110 kilocalories per kg per day. So let's talk a little bit about sleep. The baby should sleep 16 to 18 hours per day. This is to include naps. The baby should be placed back to sleep. No bumpers, pillows, or stuffy items in the bed, stuffy toys in the bed. This needs to be relayed to the parents throughout that infant period. Some parents will come clean and say that they do sleep in the bed with babies, and some parents will not say that. But it's very important for us to continue to say this and let them know each visit. The baby should have 6 to 8 wet diapers and 4 or more stools. During this period, you may find that a baby will have a different bowel regimen than the 4+ stools, but that's typically what we're going to be looking for. Vitamin D needs to start within a few days of life for breastfed or partially breastfed infants. And once the baby is switched to cow's milk, then the supplementation can stop. If the baby is born to a mom with B12 deficiency, or if the mom is vegan, then we want to start B12 and vitamins. If fluoride is insufficient in the water supply, or if the babies and their family are more prone to caries, then we do want to include a fluoride supplementation. So what do we want to look for on physical exam? It's very important to know what the heart rate is during this time period and the respirations, because if the baby gets sick, we need to know if they're breathing too fast, breathing too slow, or where their heart rate is in relation to an acute illness. We want to check the head circumference, the length of the baby, and the weight. The head circumference should be taken until the baby is 3 years old. You want to do a complete physical exam every time the baby comes into the office. So in this infantile period, we will know that the anterior fontanelle closes between 12 to 18 months, and then the posterior fontanelle closes between 2 and 3 months. If it closes before then, further workup is needed. The eyes, we want to look for the red reflex, and just overall look at the baby for any distress. Nasal flaring will be a sign of respiratory distress. If you have any nodes, shoddy nodes on a physical exam usually comes after something like an upper respiratory infection, but the supraclavicular ones are an ominous sign, and then you definitely need to follow up on those. The chest, you may have some gynecomastia or some galactorrhea. Now, the galactorrhea should go away within about 3 months. The abdomen is going to be protuberant, and then the liver can be palpable 1 to 2 centimeters below the costal margin. Now let's go to genitourinary. In a female, you may have some labial adhesions. If you do have that, we'll just watch in the beginning. If it causes UTIs or if it causes obstruction of urine, then treatment is indicated. You want to make sure that the vaginal opening is visible. In the male child, you want to look to see if the testes have descended. You can have a waiting period up to 6 months. After then, the child needs to be referred to urology. Document the meatal location. If there is a variation to where the meatus is placed, then there can be a surgical correction for that. And phimosis can tend to persist up to 3 years of age. When you're looking at the legs, we want things to be equal. So you'll check for hip dysplasia. And so when you check for that, you may have unequal folds on the thighs, or unequal leg length. When you're documenting the labs in this period, you have labs coming over from the hospital where the baby was born. So the hearing screen needs to be documented. If it was abnormal, then it needs to be repeated. The state mandated newborn screen, which is different in different areas, but it's usually going to include things like PKU, hemoglobin electrophoresis. You want those things to be in the chart, documented, and any abnormal screen is to be followed up on. Hematocrit is done between 1 year and 5 years to check for anemia, and then lead levels are done as indicated. Most children get the lead level at 12 months. Let's quickly talk about fever in a newborn. In the neonatal period, 0 to 28 days, that fever is an emergency. That baby needs to be admitted to the hospital for a complete sepsis workup and IV antibiotic. Now, in the second month of life, you can locate the source of the fever and then treat accordingly. But if that baby is sick, pretty sick as well, then that baby would need to be admitted to the hospital as well. Fever in the first month of life is likely going to be from group B strep and gram-negative organisms. In the second month of life, you're more likely to see infections from strep pneumonia and Haemophilus influenza. So it's very important to know the immunization status of your patients because they're going to be susceptible to these organisms until they're vaccinated. That brings us to the end of the infant well child exam. I will see you in the next one.